Welcome to another edition of Inside OSU. I'm Burns Hargis, president of Oklahoma State University, and we are in the fabulous Tandy Medical Academic Building here in Tulsa, Oklahoma. And with me is Dr. Casey Schrum, who's the president of the OSU Center for Health Sciences. This building's really something, Casey.
This is a fantastic building, and we're so excited to have it on our campus.
The Tandy family really stepped up on this.
Oh, yes. Yes, this building is really transformational in the way that we train and educate our students here. And the total giving towards this building was $11 million with over 150 individuals and community members donating towards this building.
And it really sports our orange color if you look at it. Well, while we're at it, you may be wondering who this is. This is Victoria.
The baby's coming.
That's pretty neat, isn't
Yes.
it? And she blinks and all that. I mean, talk a little bit about this, the importance of this kind of simulation. I mean, you haven't had this certainly to this level of technology and realism, I suppose.
Well, technology has certainly come a long ways in these mannequins, but the technology that we have with these mannequins really allows us to teach our students in a way that we weren't able to previously, and to allow those students and residents to perform procedures that, you know, in the past, the first time they were experiencing that situation was with a person. And you know, sometimes that's in a life-threatening situation or a critical situation, or, you know, even the delivery of a baby. And so with Victoria, we can simulate delivering a baby, and our students can do that for the first time.
Well, it seems to me that this kind of training is really essential given the mission of the Center for Health Sciences.
Yeah. Our mission is to train primary care physicians for rural and underserved populations. And so you think about that, the small towns, the Native American population. And this is where our students initially will get their first exposure to patient care. But then beyond here, we send them out into rural Oklahoma, and our students will spend time inside the Cherokee Nation Health System, the Chickasaw Nation, and the Choctaw Nation. We have residency programs there as well.
So, Casey, I guess the impact is really tremendous on OSU and on Oklahoma, for that matter.
Yeah, it is. This building is not only a resource for our students and residents, but we will open it up to community hospitals, IMSA, anyone who wants to utilize our simulation center, because our goal, you know, through education really is to impact the healthcare outcomes in Oklahoma, and we want to play a part in improving the quality of healthcare delivery, and we can do that through this simulation center.
So that really addresses the crisis that we have in healthcare. The statistic, I'm sure I don't remember exactly, but we're almost last in the country in primary care physicians per capita.
Yes, we rank 48th in the United States for the number of primary care physicians per capita. And when you know, looking at studies, they show that states that have more primary care physicians, those individual states have a longer life expectancy than what we do here in Oklahoma, because the only thing that is really proven to improve health outcomes is access to primary care, because that is really the front line to prevention of chronic diseases as well as health promotion.
Well, and another service that you provide is really telemedicine to primary care physicians who may be working a little bit outside their expertise.
Yes. So in addition to the simulation center here in our building, we have Project Echo, which is a knowledge sharing platform which allows us to support primary care physicians in certain areas with addiction medicine, psychiatry, HIV, to really help provide that support and the increased education that primary care doctors may need in taking care of those patients in their communities, because studies show that patients that have access are more compliant with their care, they seek it more frequently, and therefore the cost of health care goes down. So we're really looking at ways that we can support primary care physicians, we can support community providers of health care in this building as well.
And we have the Center for Health Innovation, which
Yes.
have all those patient records
Yes. Yes.
that they can data mine, I guess as they
Yes.
say. Well, what procedures can you simulate here in the Tandy building?
We have an OR simulation
That's what-
suite. Well, this is our labor and delivery suite.
Okay, labor and...
So we can simulate delivery and neonatal resuscitation in this room, anything related to maternal child health. So learning to do ultrasounds, or what happens if a mother hemorrhages during delivery. If they have to do a C-section, this mannequin they can do a C-section on, but she can be transported from here into our OR suite. We also have an ICU suite. So that is a room where students and residents can practice procedures that might happen in an intensive care unit, as well as the emergency room.
Well, let's go see some of the technology you have here.
All right.
Well, Casey, here we are in what looks like a real live operating room.
Yes, this is our surgical simulation suite inside our simulation center. And so this is where our students and residents come to learn surgical procedures. And so we have our surgical faculty and residents and students with us today.
The goal is to simulate surgery as it really is. So these mannequins and the models we have real live operations that we can attempt on them. We can make incisions, practice suturing, and perform various operations. And the goal is for the medical students to learn proper sterile technique, maintaining sterile technique during the surgeries, and to learn how to assist surgeons in performing.
How do they know how deep to cut?
It comes with practice.
Well, do we want to demonstrate?
Absolutely. If you want to make the first incision, we'll let you do that.
I've never done it before in my
That's
life.
okay. We can show you how.
Well, he's out, so I guess
That's right.
You
You
want
want to go hand me a scalpel on this side. So you can step right up here, sir.
Okay, here we go. Don't watch.
Okay.
This is not how you do it.
So we'll just hand you the knife, the scalpel here, and you
Is there a proper way to hold it?
can hold it just like a pencil is the way, and you can just make an incision from here to here.
Oh my gosh. Sorry about this, buddy.
That's perfect, just like that. Straight line. and
Dr.
everything.
Kildare. Okay, that's great.
Yep,
So there it is. I've got it open. He's not bleeding.
that's right. You're doing a great job.
Can you do?
You can keep going a little deeper if you want.
All right. Is this pretty well the way skin is when you cut into
It's
it?
a little thicker than skin normally, but
Yeah.
it's a pretty good estimate of how it's going to be.
Yeah, so it's kind of tough.
It is pretty tough, and some skin is tougher than others.
Yeah.
So you can do this, and then there's various surgeries we can attempt and perform, and practice suturing on these incisions as well to give the students practice.
So we're talking about stitching them up, right?
That's right. We'd like to. We can have a student come forward and
All right,
practice. suturing.
Carly. See if you can stop the bleeding. You just tie it off like you're sewing up a shirt?
It's very similar. Yeah, we learn how to tie the square knots appropriately, and then there's various different types of sutures we can learn and do here. She's doing an instrument tie right now, which works well.
What else can you do? What else can you demonstrate or simulate here?
We can demonstrate different laparoscopic techniques.
Would you go?
Laparoscopic is
Yeah, laparoscopic.
minimally invasive surgery utilizing camera and small instruments and ports, versus this is an open surgery.
But you can do that here.
Mm-hmm.
Oh, great.
Yes.
It's fascinating. Now you have some other simulators, don't you?
Yes.
We're going to go have
Okay.
a look at.
Okay.
Thank you all very much.
All right. Get the button.
48-year-old male, outgoing, his lawn. Wife unfortunately came inside, so he didn't feel well, fell to the ground. Approximately 10 minutes, bystander CPR before we arrived. History of hypertension and CHF. We've done approximately 20 minutes on CPR. defib the whole time. Have 5 circulations, 4 rounds of FE, 450 of amio. Great. You got an 18 gauge for access, give a 500 fluid pressure bag.
All right, Jared, get on his chest. We'll check for rhythm after CPR.
Casey, this is a real emergency.
Yes. So we are in the emergency room simulation suite, and we are watching what would be a resuscitation of a patient who's in cardiac arrest.
So we have 2 doctors here,
Yes.
right?
Yes.
This is Dr. Jennifer Galbraith,
And
and he
Dr.
is John
That's
Robbins.
good to know.
Yes.
Go ahead and start bagging.
Yes, and 2 student doctors.
Yeah, and then we've got Janelle Gwynn and Jared Horn.
Yes.
Sarah,
So
what do we
this
have
is
on
an
the monitor?
opportunity for our students and our residents to have real
All right,
life
defib.
opportunity
All right, let's get ready to shock.
to experience emergency situations.
200 joules.
Getting ready to shock him.
All right, everyone clear? Charging. Connected over here. Here we go. Clear, Janelle?
Clear, you're clear, everybody's clear.
All right. Check for a pulse, Janelle. Feel a pulse?
Yes.
Okay. Can we get a pressure?
Let's an organized rhythm.
That's Sarah White, the nurse that's taking blood pressure. So this is all very realistic, isn't it? I mean, this
Yes,
is the real
yes.
thing.
Yes.
I mean, not the real thing. But
Right, as close to the real
Yeah.
thing as we can simulate, so that students and
And so can
residents.
Sarah really hear the pulse or hear the
Yes.
heartbeat?
Yes, yeah, the mannequins breathe, have
125
a
over
heartbeat,
80.
have a pulse, can speak through the control center. They, if this patient was
We'll
responsive,
get a full panel, EKG.
we
Jared,
could
can
simulate.
you get the EKG machine?
speaking as well.
But this would be very hard to teach people in this kind of situation in a real emergency room, right? I mean, you're
It
working.
is, but we do it every day. I mean, that's
Yeah,
how
but
they
you're
train,
working
of
so
course.
fast.
But it's nice to be able to really fine tune their skills.
Yeah.
Probably on something, in a controlled setting where it's not a real patient.
Right.
And then when you get to the real thing, it's a little less intimidating
Yeah.
and it's a little more
I can see that.
natural. So,
Dr. Galbraith, could you talk a little bit about the importance of kind of communication and teamwork when you're running a code, and how
Usually,
these
yeah.
situations can be helpful?
usually there are certain people that are kind of in a position, there's one person running the code, a physician in charge, sort of making sure that everyone's coordinating, doing what they need to do. There's usually a nurse writing down everything that's happened. Usually for the students or the techs that are doing compressions, they take turns because it's physically a demanding job to do. And so they oftentimes will switch out. We obviously have help with respiratory therapy generally to do the airway after we've secured it. when
So
they're
how many
intubated.
times do you have to practice before you're ready to do a real?
Well,
patient?
ideally it would be many times, but that's not always, the situation. I mean, I remember my first time in the ER, we had a code first day, so you just kind of jump in with both feet sometimes.
But had you had the opportunity to
but
work on a
Unfortunately, yeah,
mannequin?
no, not like this.
Yeah.
It's been a while.
So this is a major
This is a
improvement.
major improvement, and the fact that now they can listen for breath sounds and the airway, they can, look and see the actual anatomical landmarks that we're dealing with is really important. They can feel pulses, they can get vital signs.
And this room is
really
state of the
important.
art, right?
It is,
I
and
mean,
it's
this is
very similar to what we have, our equipment.
Yeah.
And
Yeah.
it is state of the art. It's great.
So for the residents and students, this is a code, but what are some of the other things and advantages that you will have with access to the Tandy building for teaching purposes?
My understanding is that we'll be able to do more higher level care for airways surgical airways that we sometimes have to perform that obviously don't happen all the time, but to be able to do those when you need to and get the training on the mannequin before would be great.
Well, this has just been a great experience. I do want to thank our IMSA guys, David and Reese. Good job. You got him in time and recovered. So you did your job. You all certainly did your job. We really appreciate the demonstration. This is just a tremendous enhancement, I'm sure, for everything you're doing. So thank you, Casey.
Well, thank you very much. And before you get away, we just want to present you with your honorary coat for having participated today. You've earned that.
Well, that's great. And if you come into an emergency room and you see me in this coat, go somewhere else. That's another edition of Inside OSU. We'll see you next time.